Hi everyone, my name's Amanda Brown. I'm a nurse practitioner in Pennsylvania, so I'm coming to you from the US. I'm here to talk about the coronavirus and answer any questions that anyone has. Um, this is my first time doing a live video, so if anyone saw my little practice video, you're welcome. But I think it's working, and feel free to comment. Let me know you're here. Okay, so I was asked to speak about the current pandemic because there's a lot of information out there. We're constantly getting new information every day, and a lot of people, I'm sure, have lots of questions. Hi, okay, it's working. um, so, also my mom is here, and she is a nurse as well, and she's working at Temple University Hospital in the research department of the lung center. So she's actually doing studies on COVID-19. So if I'm gonna also defer to her for answers to questions that I don't know about. Okay, so I just wanted to start with the basics. So, what is a virus? A virus is a submicroscopic infectious agent that replicates only inside the living cells of organisms. So, humans, animals, plants, bacteria. Viruses undergo evolution that is actually millions of times faster than human evolution. So, when two viruses infect a cell at the same time, they sometimes swap genetic material and create new viruses with unique properties. So, for example, the flu strains arise this way. And the symptoms created by this infectious pathogen, such as sneezing, coughing, bleeding, put it in a perfect position to spread to the next host. So, a little bit of history. We've been through this before as a international emergency pandemic. We've seen it before in the 1918 influenza, also called the Spanish flu. So that pandemic from 1918 to 1919 affected about a third of the world's population. So it was the most severe pandemic in recent history. In the United States, it was first identified in military personnel, and this was during World War I. About 500 million people got infected, and the number of deaths was estimated to be at least 50 million people worldwide. So about 675,000 deaths in the U.S. There was no vaccine. There was no antibiotics to treat secondary bacterial infections. So control efforts were limited to isolation, quarantine, personal hygiene, use of disinfectants, limitation of public gatherings, which were applied unevenly. So, sounds familiar, right? History is repeating itself. Rates of infection came in waves due to the inconsistency of the social distancing that was happening. So, for instance, in Philadelphia, they went forward with a big parade that they were having at the time, and in Milwaukee, they shut down the city. And we saw completely different rates of infection in those areas. So over time, people, after a couple weeks of quarantine, people were getting really antsy. People would come out of their houses and gather, and the infection continued. So it occurred in waves, and at least 3 waves of infection happened because of social distancing, quarantine, and then people would get antsy. They'd leave their homes. They'd think everything was fine, and then they would have to go back into quarantine. So this happened over the course of at least a year. And since 1918, the world has had 3 additional pandemics, one in 1957, one in 1968, and most recently in 2009 with H1N1. And H1N1 affected sorry, I'm looking at my notes, affected about 1 million, I'm sorry. So in 1 year, the CDC estimated there were approximately 60 million cases of this H1N1 flu, and 300,000 hospitalizations and 13,000 deaths in the U.S. And since the 2009 H1N1 pandemic, the virus has circulated seasonally in the U.S., causing significant illness, hospitalizations, and deaths. So that was another flu virus. Now, the coronavirus is another group of viruses that causes disease in mammals and birds. The human coronavirus was discovered in the 1960s, and the name coronavirus is derived from the Latin corona, meaning crown or wreath. So the virus has a fringe of surface proteins that create an image reminiscent of a crown or a solar corona. So in humans, the coronavirus causes respiratory infections. They can be mild, the common cold, or they can be lethal, such as the strains that cause SARS, MERS, and COVID-19. There are no vaccines for these or antiviral drugs for the coronavirus. So we've heard of MERS, the Middle East Respiratory Syndrome, that occurs mostly in the Arabian Peninsula. Very severe illness, but thankfully does not. There aren't so many reported cases. The mortality rate is about 1/3 of diagnosed cases. And then SARS is severe acute respiratory syndrome, and that's a coronavirus, CoV-1, that surfaced in 2003. And the Chinese scientists traced the virus to the civets and horseshoe bats that came from the Yunnan province. So clinical isolation and quarantine remain the most effective means to prevent SARS. So the scientists, epidemiologists, doctors have been bracing for another global pandemic, similar to the 1918 influenza. And in December of 2019, the novel coronavirus, SARS-CoV-2 or COVID-19, which is Coronavirus Disease 2019, that's what it stands for, were discovered. The Chinese authorities were treating dozens of cases of pneumonia of unknown cause, and on December 31st, the government in Wuhan, China, confirmed that health authorities were treating dozens of these cases and identified a new virus that were affecting people in Asia. And they were coming out of the Wuhan wet markets. So these wet markets, they have hundreds of different species of animals that reside in these terrible conditions that people will slaughter on site to sell for food, and the blood and feces and infection, everything gets mixed together, and it's the perfect storm for a virus to be created. So on January 11th, the China reported its first known death, and it was a 61-year-old man who died, was a regular customer at the markets in Wuhan, and he had a severe, he had chronic liver disease and tumors. So as we know, the virus is most deadly to people with over the age of 60, over the age of 65, or anyone with comorbidities. On January 20th, we had our first U.S. case. On January 30th, this became an international public health concern. And on February 21st was the first death in the United States. So the number of lab-confirmed cases in the U.S. Still pales in comparison to the seasonal flu, which kills an estimated 12,000 to 61,000 people per year. Hi, everyone. I'm sorry I'm ignoring you. I'm so focused on my notes and trying to get everything out, and I don't even know how much time it's been. So experts warn that COVID-19 should not be downplayed or compared to a bad case of the flu. It is more, in the severe cases, more like severe pneumonia. In the U.S., the U.S. is leading in worldwide cases, so we're at over 300,000 cases at this time. The most deaths so far have occurred in China, Italy, Spain, France, Iran, and the U.S. So the good news is at least almost 246,000 people globally have, 246,000 people globally have recovered, according to Johns Hopkins University. Okay, so symptoms. We see fever, shortness of breath, and cough. The cough is typically a dry cough. In most people, it presents itself within 4 to 5 days. The incubation period is from 2 days to 2 weeks. So in that time, you can be symptomatic or asymptomatic and have the active live virus and spread it, which is why social distancing is so important. So we see mostly the fever, respiratory symptoms, the cough, and then severe pneumonia can occur in some patients, which presents as severe respiratory distress, rapid rate of breathing. You can notice a bluish tint to the lips. This is all signs of respiratory failure. So we also see signs of, the less common signs are, and fatigue is a big one too. Body aches and fatigue. So less common signs are sore throat, headache, nausea, diarrhea, inability to smell or taste. So after the 14 days, typically you're not, if you haven't shown any symptoms, but you've been exposed, after the 14 days, it's thought that you will not be a carrier and you won't spread it. So if you are having symptoms, then I'll get to when you're safe to interact with people again. So if you've been in contact with anyone that has the infection, or you've traveled in the last 14 days, these are the times that you really want to quarantine and make sure that you don't show the symptoms, or at least stay quarantined for the 2 weeks, so that if you do have the virus, you don't spread it. So home isolation is suitable. Patients who are older or have underlying health conditions or immunocompromised should contact their physician early, even for mild cases, just to have some close monitoring. And then if you're having severe symptoms, then you'd call your doctor or go straight to the emergency room. There are currently no drugs that will prevent it if you've been exposed to the virus, but there are drugs being trialed currently. You can use Tylenol. You can use your normal medications that you'd use for any cold. There have been some questions about NSAIDs like Advil, Motrin, ibuprofen, but that's still they're still doing trials with these, so we're not sure yet if NSAIDs will make the disease symptoms worse. But if you're concerned, just use Tylenol or paracetamol, acetaminophen, that sort of thing. So people who are immunocompromised, people who are 65 years or older, people who live in nursing homes, long-term care facilities, people with chronic lung diseases, people who have serious heart conditions. Even smoking is on here for a list of things to put you at higher risk, and severe obesity, so a BMI of 40 or higher. Anyone with diabetes, chronic kidney disease, liver disease, for pregnancy with any illness is considered high risk with pregnancy. So that's why we haven't necessarily seen terrible cases in pregnant women, but we just want to keep those people safer. Young people have been found to not have severe cases of the illness. So if you are in one of those groups of, less than 60 with no health concerns or chronic health conditions, you're in a really good place to have a mild illness. So that's reassuring. What we can do to stay healthy is to eat healthy, get 8 hours of sleep a night, 20 minutes of sunlight daily, exercise 30 minutes a day or more, drink plenty of water. You can take your normal vitamin routine. If you want to add vitamin C or vitamin D, there's been no studies that have shown that any of this is going to prevent you from getting sick, but keeping a positive attitude, connecting with friends. Take this opportunity to quit smoking. You won't need to go to the store to buy it. It will improve your immune system. It'll improve your lung function. Also, avoiding close contact with anyone at this time is so important, and I know it's so hard. And if you can just keep it to the people in your household, that is the best thing. And if you do need to leave the house, the CDC is now recommending that everyone wear something over their face, a cloth face covering. I'm going to also leave in the comments some links to more information, how to make your own face covering, how to make your own hand sanitizer. You want to keep 6 feet social distancing in public places, wear the mask, wash your hands, wash everything that you bring into the house. You can wipe it down, or leave it for 3 days. The virus will last up to 3 days on plastic, and less time on other objects. But, to be safe, we want to wash everything or leave it in its own quarantine for a few days. So if you do have the virus, then of course we want you to stay home, stay in touch with your doctor. If there's other people in the house, try to stay quarantined. Try to cover your mouth and nose when you sneeze or cough. Wash your hands. Don't share dishes. These are all common sense things. Wash everything. Phones, remote controls, counters, tabletops, bathroom fixtures, toilets, keyboards, bedside tables. And so people with COVID-19 who have stayed home can stop home isolation under the following conditions. If you don't have a test, and you can leave your home after these 3 things. You have had no fever for at least 72 hours. That's 3 full days without a fever or any medications that will reduce a fever. Symptoms have improved, and at least 7 days have passed since your symptoms first appeared. If you will be tested to determine if you're still contagious, you can leave home after these 3 things. You no longer have a fever, other symptoms have improved, and you've received 2 negative tests in a row. So right now there is no vaccine, there are no drugs yet confirmed to actually help with the illness, but there's over 80 clinical trials worldwide going on. The international community is working together like never before to produce a coronavirus vaccine. However, vaccines typically take up to 10 years to produce to make sure that they're safe and effective. So we're hoping, being optimistic, that it'll be about 18 months before a vaccine. So what we're seeing now with the spread, America is still increasing in numbers. However, China we've seen a big increase and then a drop down and then a leveling off because of social distancing and because of protective measures. So that is really reassuring. However, once the curve starts to flatten and drop, it will probably be at least a month from that point. Then we can start to level off as well with social distancing and with quarantine. So in this time of isolation, I know that it's really difficult for a lot of people. I recommend limiting your time in front of the TV watching the news. If you need to just check in, 1 or 2 sources for a few minutes, see what's happening, but try to focus more on things that are positive and things that you can do to benefit you, whether that's journaling, exercise, working on a side hustle, or working on your own personal growth, learning new things, working on hobbies that you haven't been able to work on. So the reason why it takes a month after the drop off is because the drop off means it's working. So the isolation is working. So there's still people out there that are able to spread the illness. There's still people sick because the problem with this illness is it lasts so long. So a 2-week time period right now, right now we're 2 weeks behind. So when we see the dropping off, we're actually about 2 weeks behind. So we need to go 2 weeks from this point to get the full scope of what's really happening in real time. For instance, in my area, there's only about 27 cases in my whole county. However, this information is about 2 weeks old. So we need to it's taking up to 10, 11, 12 days for the test results to come back. Any other questions that I missed? Okay, I think I'm going way over my time, but do we have any more questions? So what I want to leave you with, okay, my mom said we don't know about the asymptomatic people that have not been tested, so we don't really have an accurate count. So I want to leave you with the notion that by staying home, okay, how to use masks and gloves properly. A mask should be snug on your face, and it can be made out of any cloth materials. So I'm gonna add in the comments a tutorial of how to make your own mask out of a cut up t-shirt and rubber bands. Yes, the masks help because it's preventing the droplets. So this is spread through coughing and sneezing because of these droplets in the air, or droplets coming from the source and landing on surfaces. So if we cover our mouths, even the asymptomatic people that may sneeze or cough, without realizing it, they are not spreading the illness. So we've really seen in other countries who have done this nationwide covering of the mouth, like in China and other Asian countries, that they are slowing the spread. In the U.S., so I'm gonna also link a map of the growth, like the curve of the spread of different countries in the world. So right now in the U.S., it is steadily climbing, so we are not anywhere near a drop-off yet. So we're still waiting for the flattening of the curve. Right now it's just going up because we're testing a lot of people, and many people have this and don't know they have it or assume they've had it, but it's just a really difficult thing to monitor if not everyone is getting tested. So when it comes to gloves, I personally don't wear gloves when I'm out. I wear a mask, and I just wash my hands after I'm touching anything, and I don't touch my face. So use Purell, use hand sanitizer before you go to the store. Before you get out of your car, use it. Shut the door with your elbow. Don't touch anything but the items that you need. Once you put them, once you get home, get back to your car, use the hand sanitizer, get home, wipe everything down, and wash your hands again. I think that I'm really optimistic that if we do all these things, we will stay safe. The patterns that I've seen is that the people who are getting these severe cases are really in close contact with others that have, and for an extended period of time, like up to 30 minutes, with others that have it. So if you have any questions, please message me. And you can contact me on Facebook. I'm happy to answer any questions, or if I don't know the answer, reach out to someone who does know the answer. And I just want to reassure everyone that we're all doing the right thing by staying home, and we're all in our power by staying home. And it's really amazing. Every day that goes by, we know that we did everything that we could, and that we've done our jobs, and that, you know, this is all temporary. It's going to end. We've seen it before. We've had multiple pandemics in the past, and we are being extreme with these quarantine precautions because we want to, even if it just saves one person, even if it just saves that one person that is immunocompromised or is elderly, it's worth it. It's worth us staying home. I have really admired our government officials and healthcare workers and society as a whole, that they are valuing human life over money. So we're seeing the economy tank, and that's scary. But we are also, you know, as a whole, as a global community, we're saying even one life is more important than money. So that, to me, is really reassuring. I feel like there's a lot of other things I wanted to say, but it's okay. Thank you, everyone, for coming to my TED Talk. All right, so if everyone wants to get a comfortable seat, close your eyes, think of something that you're grateful for, smile for the beauty in the world, for the environment that's able to breathe, for our connection to each other on the internet, through hilarious memes and parodies and Netflix and all of the amazing things that we have now that they didn't have back in 1918. All of the healthcare workers working day and night, and the scientists working day and night to try to come up with a vaccine, to try to come up with a cure, with medicine. And I mean, this is the greatest time to be alive during something like this. Although this illness is a huge bummer and it's spread really rapidly because of globalization, it's also because of globalization that we will work together and treat this and get through it. This is all temporary, I promise. So take a couple big deep breaths, breathe in all this gratitude, hold it into your heart, and now extend it out in prayer for others who are suffering, people who don't have anyone, people who are alone, people who are sick, people who are angry. Give them this love and this gratitude that is so abundant in you. And then take that love back into your heart. Big deep breath. I love you all. Please, if you're feeling sad, depressed, sleeping a lot, anxious, please reach out to someone. This is a really, really difficult time, and you are absolutely allowed to have all of these emotions, all of these feelings that you're having. But if it's starting to affect you negatively, if these thoughts, this pressure, this anxiety is weighing on you day and day, please reach out to someone online. There's mental health experts, there's therapists, counselors, health coaches. You're not alone, I promise you so much. You aren't. Okay. Mwah. Thank you so much. Bye.